Since COVID-19 hit last year, there has been a silent pandemic going on. The public health crisis that disrupted our way of life has seen a residual effect on mental health. After schools shut down for nearly 9 months, concerns arose on what that impact of the extended closure was on the youngest in society. Well, tonight we look at the concerns experts are raising on the impact of childhood trauma as a result of the pandemic and the measures they seek to put in place before it's too late.
The high school teacher from Kisii School is fighting for his life, while a second one is nursing injuries after being stabbed by a Form 3 student.
Reports of a surge in attacks on teachers after schools reopened made headlines early this year.
Police in Kemera area, Nyamira County, have arrested a Form 2 student at Mokwerero Secondary School for attempting to kill the school's deputy principal in his office using a panga.
The pandemic that saw the unprecedented closure of schools for months appeared to be breeding an unseen problem. In the early months of the COVID-19 pandemic, increased cases of sexual and gender-based violence were being reported. Recently, statistics from the Ministry of Public Service and Gender revealed that there was a 36% spike in GBV cases in 2020, when 5,009 cases were recorded. Homes became battlefields as families grappled with significant lower incomes, and the public health crisis visited homes with unexpected COVID-19 deaths. Children, being part of the most vulnerable in society, as in any crisis, bore the brunt. Now, more than ever, there is need to address the impact of the pandemic on children and youth, which experts fear could spiral out of control if unchecked.
We must prepare for the avalanche of mental disorders that will come inevitably, not only directly from the coronavirus, but also from the consequence. And remember, other than the economic consequences, there are social consequences. The instructions we've been getting about not visiting our mothers, not going to funerals, not hugging each other, these are all things that go against the natural ways that we protect ourselves from mental disorders.
So we just need to understand that
Sheila, who is now in her 30s, was a troubled child. She struggled with depression and made her first suicide attempt at 13 years old while in boarding school.
I was socializing with people, but not really connecting with people. I just felt like I always had these low, deep, heaviness in me. And I knew that something was off. But I never really equated it to mental illness. I just knew I had deep sadness and a heaviness in my heart. So corporal punishment was huge. So we used to be caned so that we can perform better in school. So there's always this perception and misconception that kids are just naughty, and to discipline them, just beat them up.
She believes the hostile treatment at school and strenuous home life contributed to her poor mental state that she nor anyone else around her could identify. For about 20 years, she carried the trauma and accepted it as her life sentence.
I had life stresses that brought me to this point, and addressing them, I had to look within and find out what parts of me were damaged. I had rejection issues. I felt unworthy. I felt unloved, and all of those things. So my faith is what helped me.
She since started Jenga Africa, a mental illness support program for the youth that addresses developmental issues in Africa with a focus on depression and suicide.
I went back to school systems because that's kind of where my battle began with depression, or rather intensified. And we've seen so many people get better. I always believe young people should be focused on school and shouldn't be worried about stuff their finances and money, because that could be also another reason why someone is feeling depressed as a child. We shouldn't be dealing with these feelings when we're younger. So we help them to find coping mechanisms also with how to deal with their families. I come from a broken family, and growing up, there was a lot of fights and so on. A lot of young kids come from the same background.
Sheila's program is one piece of the larger solution puzzle the government is seeking to put together when it comes to addressing mental health among the youth.
We are developing a curriculum to be presented to the Ministry of Education for the purpose of embedding it into the curriculum of teacher training, meaning that in the future, teachers will be able to recognize the 50% of people who develop mental disorders while still in primary school. Because 50% of all mental illnesses can be diagnosed in primary school. The reason we don't diagnose them is because the teachers have not been empowered on how to recognize them.
It's one of the recommendations from the Mental Health Task Force report handed over to the Health Cabinet Secretary last year. The hope is as families prepare for post-pandemic life, such tools will help them identify red flags and address them in good time. All right. Now, Esther Njeru, a family and marital psychologist, joins me now to give perspective on this and more solutions for parents seeking to help their children and youth manage mental stress. Esther, thank you so much for joining me this evening. You deal a lot with children in your line of work. You know, since the pandemic hit, since the closure and reopening of schools, what kind of mental stressors are you seeing children exhibiting now?
Okay, since the pandemic, the COVID pandemic set in, children have actually gotten quite isolated. And this kind of isolation is causing a lot of distress to our children. And most of them claim that they're feeling stressed and they suffer anxiety and they go into depression. So in this case, you find that a child who has gotten all these kind of, who is presenting this kind of disorders has changed their behavior and they're not able to express themselves. And these children express themselves in some kind of funny ways, like they would write letters, they would draw pictures and do some funny scenes, maybe because of the trauma that has been caused by what they're going on right now.
So how would you describe the trauma? Because we are likely to see a lot more of that being exhibited in terms of childhood trauma. What does that look like in the practical sense for a parent who, is trying to figure out, is my child actually exhibiting some form of trauma?
Yes. Some of us parents would actually ask this question: what's wrong with this child of mine? So, and why they ask this kind of a question is because a child who's been performing very well in school has drastically dropped in their performance. A child who's been behaving like a grown-up child, maybe a 5-year child who's not been wetting their beds, has come back now into wetting their bed and clinging on too much to their parents. They're fearing something. They're afraid of something. So when a parent sees this in their child, actually that's the question they ask: what's wrong with my child? But it's not, the child will not answer them. So the best thing is to ask ourselves, what can you do to help this child who has changed their behavior drastically?
So that's my next question. What can a parent, a teacher do once they have identified there is a problem?
Yeah, as a parent, it will be advisable to get close to your child, listen to them, and talk to them with a language that they can easily understand. For example, in this time of COVID, you might find that the child is wondering, why is mommy, why is daddy in masks, why are they in gloves? You see these things that they used to see in hospitals, and in hospital you see a nurse who is about to prick them with a needle. That's what they see in the hospital. But now they're seeing their mommy, their daddy with the masks, just try to explain to them in a language that they can easily understand. If a child has lost, if they have lost a loved one, like a grandma or maybe a parent, let the child know that mommy has not gone, mommy or grandma has not gone somewhere and they are coming back, they have gone away. Explain to them that, okay, this person has died, and just mention the ones. Explain to them nicely in a way that they can understand, because they will not understand that when do they go and will never come back.
Esther, I have to ask you this because you mentioned how things have changed. We have to wear masks now. You're being told to social distance. We've seen that shift in the way we do life. But what does that mean in terms of the trauma that is kind of brewing right now? If it is not addressed, because this is the first time we're seeing a disruption like this in a generation, right? When these kids grow up and become adults and don't deal with the mental stressors or the trauma that they're experiencing now, what are the implications later on?
Yeah. If this trauma is not addressed early, it will progress as a child grows. They'll carry it with them in their adulthood. And this might bring up cases like distancing, isolation. They will have problems with relationship issues. They will have problems with creating boundaries. They'll have issues with empathy. And at a point where someone lacks empathy and there's a conflict in a family setup, that's why you're seeing things like
All right, we appear to have lost Esther there, but of course, towards the tail end of our discussion on childhood trauma, some great insights coming in from her on what parents can do if they notice that something is a bit off, and of course, resources that are available. For instance, the psychologists and psychiatrists who are on hand now to give that support to children trying to navigate this time, this space, this period that is just as difficult for adults as well. Well, that does it for Citizen Weekend. Thank you so much for watching. I'm Victoria Rubadiri. Our sign language interpreter tonight has been Wilson Mushora. Stay